Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, anatomy of the bone. Anatomy of the bone. Bone is actually made up of the following things. A bone is made up of epiphysis, metaphysis, and diaphysis. Epiphysis is the upper end of the bone is called as epiphysis, and the lower end of the bone is also called as epiphysis. So the ends of the bone is epiphysis and the middle part of the bone is diaphysis. The area between diaphysis and epiphysis is the metaphysis. This metaphysis is the most vascular area of the bone and it is the most common site for infections. So, metaphysis is the most vascular area of the bone and it is the most common site of uh, most common location of infection is metaphysis. Then we have physis also. Between epiphysis and metaphysis, we have a small growth plate which is called as physis. And this physis is a radiolucent area which is made up of the cartilage. Then this diaphysis is the middle end of the bone, and the diaphysis is most commonly called as is most common site for Ewing sarcoma. Now, in the diaphysis, on microscopic view, there will be many osteocytes are arranged in lacunae-like structure. So, these are the different lacunae or where the osteocytes are arranged in concentrical manner, and the center of the osteocytes is actually containing blood vessels which is called as Haversian canal, and surrounding it there is a line called as cement line at the end, and there are race like structures which are radiating from the center of the lacunae to the from the lacunae to the center of the Haversian canal. The two Haversian canals are connected to each other by a Volkmann's canal, and the whole bone is surrounded by the periosteum. Bone has a medullary canal and it has a cortical bone. Cortical bone contains all the osteocytes, whereas medullary bone contains the medulla, which is bone marrow.
thank you and thank you for watching.